Good morning, everyone. Thank you for your patience as we got today's press conference up and running. Today we will be hearing from Mayor Jenny Durkan from Seattle, Chief Harold Scoggins, and Patty Hayes, Director of Seattle-King County Public Health, on expanded testing here in Seattle. Today's press conference, we will be doing Q&A using the written Q&A function. We are going to be answering questions during the presentation from staff who will be providing updates and answers as we go. And at the end, I will read questions following the program that have not yet been addressed. As a reminder, anonymous questions will not be considered. And as always, please include your name and agency so we know who we will be speaking to. And with that, I'd love to hand it over to Mayor Jenny Durkan.
Thank you so much. And thank you everyone for being here and for bearing with the technical difficulties we've been having. It just reminds us that we are still in the midst of a great public health crisis, one that has faced our city now for months and is the greatest public health crisis since 1918's flu. It's in some ways greater than that because we're a different city from then. We're much more dense, much more urban, and face challenges on other fronts. We are 7 months from when the first case of COVID-19 was confirmed in the Northwest. And unfortunately, we're still solidly in the midst of a global pandemic. We learned early that the highest level of our federal government was incapable of the leadership that we needed. And sadly, for our communities of color, and particularly for our Black and Latinx communities, this crisis has disproportionately hit them, both on the health front and on the economic devastation that followed. The pandemic has laid bare the inequities of our system, making it imperative that we support those communities with strong policies, including testing resources. Where national leadership stepped back, the Seattle and our region stepped up. We are determined to see what policies we can have to have the greatest impact to help our city through this and to make sure we particularly focus on vulnerable communities. To protect frontline workers and residents, the city has launched a PPE collection program that surpassed 1 million items to deliver to shelters, community health clinics, and long-term care facilities. We also provided more than 45,000 face coverings to community-based organizations for our most vulnerable members of our community. We deferred utility payments, supplied grocery vouchers, implemented one of the first in the nation moratoriums against evictions. We will continue those programs to help the residents and businesses of our city as we continue to struggle through this pandemic. And led by what we could call our tester-in-chief, Chief Scoggins of the fire department, we have implemented innovative and nationally recognized testing responses. And those have included a pilot of a mobile assessment team program that went and tested in long-term care facilities, the first in the nation testing facility for first responders, administered by first responders, a pilot that was so successful it was expanded for healthcare workers and frontline emergency shelter workers. Thus far, we have administered over 80,000 tests at our citywide testing sites, averaging over 2,000 tests a day. Let me put that in some perspective. There have been approximately 550,000 tests in the state of Washington since the beginning of June. Our 2 citywide testing sites have conducted approximately 15% of the statewide number just since the beginning of June. As the FYI guy noted earlier this week, nine of the top 10 areas in the county for testing are in the city of Seattle. Testing saves lives, and I also believe it's why it has led to lower cases in the city than the rest of the county. I think it's important to note it has also led to lower cases of cities of similar size. We are the 18th largest city. We currently have about 4,000 cases of COVID in our city. Compare that to some cities of roughly the same size. San Francisco has over 6,400 cases. Denver, over 9,500 cases. The District of Columbia, 12,000 cases. And Boston, 14,000 cases. That doesn't mean we're out of the woods. Testing just gives us one indicator, and we need everybody to take the precautions that are urged by King County Public Health, and later you hear from Patty Hayes on that. If you go out, please wear a face covering, wash your hands frequently, stay 6 feet from people. If you have a vulnerable health condition, or if you're a senior citizen, if you're someone over the age of 60, go really limit the amount of time that you're spending out. We're in all of this together. Despite our continued challenges, we have continued to see increase in the number of cases. The city knows that we need to do more, particularly for our vulnerable communities and particularly for communities of color, which again have just been disproportionately impacted. So we will be expanding our free, and I want to urge that again, it's free. It costs you nothing to get tested at these sites. Our free citywide testing. We're adding a walk-up location at Rainier Beach High School in South Seattle, and soon we'll be announcing another location in Southwest Seattle. You may all know that I have a particular affinity for Rainier Beach High School. I was honored to host my very first State of the City there 2.5 years ago. Rainier Beach students have led the way in pushing for equity in our city. In fact, it was their early advocacy before I became mayor that raised the issue of access to transportation. And we were able to make real on that by implementing my 2018 ORCA Opportunity Program, making us Seattle the 3rd largest metro area in the nation to provide free transit for high school students at the time. We were able to also expand that to some of the people in our affordable housing complexes. We need people to have access to transportation because it not just for their jobs and their community and family, but really as a passport to their city. I really continue to be inspired by the fearlessness of the Rainier Beach community, and it is only appropriate that this testing site be there. Beginning Friday, August 7th, so that's next Friday, the City of Seattle will launch in the Rainier Beach High School testing location. It previously had hosted the UW Harborview Mobile Unit. Free testing operation will be walk up, have expanded capacity in days and hours. It will be available Monday, 5 days per week, on Mondays, Wednesdays, Saturdays from 9:30 a.m. to 5:30 p.m. We're going to post those hours so you don't need to memorize them now. Through our continued partnership with UW Medicine and Public Health Seattle King County, we expect to be able to test 800 people a day, increasing testing capacity tenfold for this neighborhood. As with our original drive-up testing sites, we ask that people pre-register prior to testing. And you can visit our website at seattle.gov/COVID-19. Pre-registration really helps us get the line moving more quickly and reduces the wait time to 10 minutes or less. Again, it's a walk-up place so people in the community can come right there, but please try to register in advance. As the chief and Patty Hayes will tell you, we try to accommodate everyone, but that makes it easier and better for everyone. Really important, no patient will be charged for the testing, and you will not receive a bill. We all know that without a vaccine, the most important thing we can do is to practice excellent hygiene. Like I said, please wear a face covering, wash your hands, keep 6 feet apart, limit gatherings. I've been out and about and I've seen more and more gatherings, people having backyard barbecues, gathering at parks for games, doing a whole range of things. It's summer, it is really hard not to, but we are in the midst of a pandemic. The numbers of infections are rising in our state, in our city. We don't want to go backwards. Testing is a key way that we know that we can help go forwards. I'd now like to turn it over to Chief Scoggins, who will tell you a little bit about the testing program we've had in place and what you can expect in Rainier Beach, and then he will hand it over to Patty Hayes. Thanks all for being here.
Good morning. Good morning. And Mayor, I want to say thank you for your leadership. It has been tremendous in this area in us getting to where we are today with testing in the community. I also want to give a few more thank yous. Thank you to Principal Ivory Brooks from Rainier Beach High School for your willingness to partner with us as we have been working hard to get this site set up Thank you to the University of Washington for your partnership. We could not do this without you. Thank you to Seattle King County Public Health Director Patty Hayes and your team for working with us on so many different fronts. And then thank you to the Washington Department of Health for trusting that we in the city of Seattle and the Seattle Fire Department could do a good job in this space. I remember back on March 13th when we had the conversation with the state of Washington Department of Public Health asking for permission to do this, and we got that permission. And that next day on March 14th, we started training our firefighters to actually do this COVID-19 testing. And boy, we've come a long way since then. I remember back on January 22nd when the Seattle Fire Department sent out its first department-wide email notifying the department that we were watching this virus start to transition around the state of Washington. And we've come a long way since then. And as we started testing our firefighters and our police officers and first responders in the region, we knew that would be important for us to keep our first responders safe as they responded to you to meet your needs each and every day. And, you know, COVID-19 hasn't skipped the Seattle Fire Department. We've had 19 firefighters test positive for COVID-19. We've had 130 in quarantine and isolation over the last several months. But we've been able to know that because we've been able to test them and find out immediately and put them in quarantine and isolation so we can take care of them. We also transition testing in the community for those who passed away in the community. Our paramedics were trained to do that. So we've been doing that for several months now. And then, as the mayor mentioned, our mobile assessment team assisted in the long-term care facility, in nursing homes and assisted living facilities and adult family homes, in helping in that space also. And it was back on June 6th when we opened up our first testing site, our community testing site in partnership with the University of Washington under the guidance of Public Health and so many other partners that has allowed us to get to this point. I'm so proud of the work that our firefighters are doing. I mean, 6 months ago, if you would have told me our firefighters would be doing COVID-19 testing of any sort, I would have probably laughed and said, what are you talking about? But the thing about firefighters is we look for a way to help. We look for a way to serve the community. And this was another way for us to serve the community. So as we move forward with opening up this third testing site, we're really excited about that because we're going to be able to continue to serve the community. Right now, we're testing a little bit over 2,000 people a day. Some days we're as high as 24 or 2,500, but most days we hover around 21 or 2,200. This third site that's going to be opening up on August 7th at Rainier Beach High School, we expect it to have a capacity of about 800 additional tests, which will take us to about 3,000 tests a day at these three sites. As the mayor mentioned, these sites will be open from 9:30 a.m. to 5:30 p.m. and it is a walk-up site and it is ADA compliant. We are asking all those who attend to please go to seattle.gov/COVID-19 to register online. That really makes the experience run a lot smoother. But I do want to say no one will be turned away, but we are asking everyone to register online. That's very important. We've been doing this for a little bit now. I think we have a really amazing system in place that's probably going to start to be replicated, hopefully around the state, because our firefighters are doing amazing work in this space. And once again, I do want to echo what the mayor mentioned earlier is, wear your mask, wash your hands, remain physically distant. If we can do those little things, all those public health requirements, we can continue to bend the curve and continue to move forward and helping the community reopen. Now I'd like to turn it over to Director Patty Hayes, Director of Seattle King County Public Health.
Well, thank you so much. It's a delight to be here with this wonderful announcement today. I want to add my thanks to everybody who's on the phone, but Mayor, to your leadership and Chief Scoggins, to our wonderful partnership. It is making all the difference in the world, and to UW Medicine for stepping up and being a huge partner in this. I do believe, as the chief just said, that this is a model for the nation on how to work together during this pandemic. And we clearly have shown that being responsive to the community efforts that need to happen, and as you've heard both from the mayor and the chief, to really emphasize the other important measures like social, like physical distancing, and washing your hands and staying home when you're ill and wearing a face covering. Those are all part of what we all need to do together. So my eternal gratitude for the great partnership. You know, the increase in COVID-19 cases is continuing, as you heard from the mayor. And the average of number of cases per day we're seeing is around 150 to 170 per day. Young residents and folks less than 40 years old remain the largest population who are experiencing the outbreak right now. But it's not going to be isolated to this population. It's going to affect folks older than 40, and we know that folks who are older than 40 and those with chronic conditions have more chance of having a severe outcome. And so we want to make sure we are just really encouraging testing at the right time, as the chief outlined. We continue to see disparities in rates of infection by race and ethnicity, with some communities of color experiencing 3 to 5 times higher the rate of infection. That's why it continues to be necessary for us all to take steps to limit our activities out of the home and limiting contact with others and remembering these core strategies. You know, testing has doubled since June. We've got a long way to go to have enough testing capacity across our region, but I think in terms of what is occurring in other areas of the country, we are just doing an amazing job. And these sites are just a critical step, particularly since we have worked together to place the sites in areas where we know there is a high need and potential for reaching critical populations that we want to make sure it's easy and folks can get testing. So access to testing is crucial to obviously identify people in need of medical services, ensuring that they get the services they need. In addition, to help people connect with those resources, including the isolation and quarantine, in order to reduce the risk of transmission. And then it helps us with our contact tracing in public health so that we can identify potential spread and outbreaks and reduce the risk of further transmission. Expansion of testing through these sites is particularly important for those if you don't have a healthcare provider or insurance. And the messages from the mayor on this are just critical, that we want these sites to be open, that there is no charge. You can come, please sign up, and we work to accommodate everyone. If you know you've been exposed to the virus, or if you have symptoms, the first and more important step is to stay home and away from others, except to go to your testing appointment, because the first few days of an infection are when you're most likely to spread it to others. By self-quarantining, you're protecting your family, your friends, and helping all of us succeed at reopening King County. So again, I want to thank all the partners who are working to close the gap in testing access, and particularly in areas where we see the highest rates of cases. So thank you so much. Remember, wear a face covering, wash your hands frequently, physically distance yourself, and particularly if you're not feeling well, please stay home. Thank you.
Thank you, Director Hayes. Thank you, Chief Scoggins, and thank you, Mayor Durkan. As a quick reminder to everyone, if you would like to ask a question, please type that into the Q&A. We have a handful of questions that have already been answered. And so I would like to turn it over to the mayor or to the chief or to Patty, Director Hayes. There have been a few questions from Ryan Blevins, Seattle Times, Esme Jimenez, KUOW, about the location of another testing site that has been referenced. So let you all decide who is the best to answer that question. They want to know where that may be located.
Sure. Good morning, Anthony. I'll take that question. The fourth testing site that we're targeting is in Southwest Seattle. Right now, we're working out the final details and the logistics around opening that site. And once all of that is worked out, we'll be announcing that publicly. But it's in Southwest Seattle.
Thank you, Chief. This next question is for Director Hayes. How many tests on average would you like to see for us to be in a good place? This is from Nick Popham, Como Radio, or Como.
Great, thanks for that question. Well, since the partnership with the City of Seattle, we have seen a dramatic increase in the tests. But again, it's true, it's not enough. We would like to see up to 60,000 case tests happening. We're about halfway there. And we continue to work to use the example that the city has set for the rest of the county and to look for partners to help us continue to expand. You know, it's a critical partnership with a lot of folks around in both the healthcare system as well as our community-based organizations. So we will continue to work to expand testing, but it's part of a core strategy that I just want to remind everybody that testing alone and contact tracing alone will not resolve our outbreak. We really need the other strategies. So it's a combined, really important continuum of efforts that we need. But that's where we're going with testing.
Thank you, Director Hayes.
Can I just add to that real quickly, Anthony?
Of course.
I just wanted to give another shout out to Seattle King County Public Health and to Chief Scoggins for the expansion we have done. Again, you know, I think it's rather astonishing that in the statewide, the City of Seattle, with its own resources, is providing about 15% of everything being offered statewide. And that we are 9 of the 10 top sites in the county. So I also agree with Director Hayes that we would love to see more people stepping up to help the county in this front. We know that there's a number of communities of color, particularly in South King County, who are seeing the disproportionate impacts of this disease, and yet we don't have the number of facilities that we want in those areas as well. So we want to do more in Seattle. And again, I want to also echo what Director Hayes said. Testing is just part of the strategy, and a positive test means that some of those other interventions have failed. And so the best way to keep yourself healthy is really physically distance 6 feet, wear that face covering wherever you are, wash your hands frequently, and do those, you know, non-pharmaceutical interventions. It's going to be a long time before we have a vaccine. It could be this time next year before vaccines are widely available. This is a long marathon for us. And so testing is really one part of it. The contact tracing is another. But the best line of defense against this virus is everybody who's watching this. Every individual and the actions they take will determine what happens in our community.
Thank you, Mayor. Question, I believe, for you from Will James, KNKX Public Radio. Can you talk more about the decision to locate this new site in South Seattle? Was this a strategic decision?
Absolutely. Thank you for that question. Yes, we saw, you know, we continue to see a disproportionate impact on the disease burden on communities of color. It's one reason why the other one will be in Southwest Seattle. And we know that the key to this, one of the most important things, is to have adequate testing. We wanted to make sure that we had something in the communities and neighborhoods that are being disproportionately impacted, but also make it easy for people, which is why we chose the walk-up site. Again, I want to thank the University of Washington. We've been partnering with them all along. We worked with them for that Atlantic Street boat ramp. It was a very successful site. It helped us get more testing and then follow up with more healthcare resources into those communities. So we want to continue to make sure that those communities that are disproportionately impacted have access not just to the testing, but also to the other healthcare resources, food resources, and other things to stabilize those communities during this very, very difficult time.
Thank you, Mayor. And this next question from Ryan Blevins for Seattle Times is for Director Hayes. And I think ties in nicely to that answer. You said that some communities have had an infection rate 3 to 5 times higher than the rest of the county. Which communities were you referring to?
So these communities are our Black, Indigenous, and other people of color, as the mayor has just said. We see this predominantly, and as she reflected, in the South End. Some of the largest infection rates for our BIPOC communities are down in the very south part of the county. So you can see it on our website, where we have a race ethnicity dashboard up that can be referenced, and you can see it by areas of Seattle as well as areas of King County.
Thank you, Director Hayes. And we have one last question that again is on this same topic from Caesar Lake City Collective. When people make appointments at Aurora and Soto sites, they don't collect data on ethnicity. Is that question going to be added to the intake form to see disparities or barriers in testing access?
This is a very timely question. The standards for what needs to be collected for testing of COVID is aligned with other tests that are sent by healthcare providers into the labs. And Secretary Weisman of the State Department of Health, our Secretary of Health, has been working with the State Board of Health on what are the elements that need to be collected when tests come out. He's put an emergency rule forward, and the State Board of Health is having a hearing on it next month. But there is an emergency rule out asking for race and ethnicity to be added. This is important data for public health and the city of Seattle and other partners to have. We need to be able to know this. So we'll be working on implementation of this. It's going to be new for our healthcare system, for some partners to add this. Indeed, the conversation with the chief and how it fits in with these testing sites we'll be having over the next weeks or so on how we integrate that in, and as the State Board of Health makes it a statewide requirement.
Anthony, if I can add to that.
Anthony, can I add to that just briefly? So I want to, it's a great question, Cesar, and it is one that I've had conversations with both the governor and the county executive on how important that was for us in this crisis, to be able to drive resources to communities that were disproportionately impacted. It's interesting because, as Director Hayes said, our healthcare system has actually in many ways been set up to purposely not ask for certain demographic information because of the stigmatization that occurred in prior healthcare crises. But now we're seeing that just the opposite is true in many ways, that we need that information in order to get the resources for prevention as well as treatment to communities. So I want to thank you for that. And I do want to thank the Department of Health for issuing that, because for months now we've had discussions talking about how critical it is for us as elected leaders to have that information, and really relying on the public health system and the collection of data forms to get us the information we need. So thanks very much for highlighting that issue.
And Anthony, to add a bit more to that, we do ask the information on race and ethnicity. It is in the paperwork that people fill out, but it's not a required piece. So a lot of people do not fill it out, but we do ask that information. Thank you.
Thank you, Chief. And thank you to everyone today who joined us. That will conclude today's Q&A portion. Mayor Durkan, if you would like, I will hand it over to you for closing thoughts. Otherwise, we can end it here.
Again, I don't think we can say it enough. First, I want to thank Patty Hayes and Jeff Duchin at Seattle King County Public Health for the great partnership we've had since even before February 29th. But when we got those first diagnosis of deaths and cases, we have been working nonstop with them and with Department of Health at the state level. Our city and our state really have led the way in many ways, but our success is 100% dependent upon the residents and businesses of Seattle. And going forward, we know that we will continue to have these challenges as the case numbers go up. Right now, those case numbers are in mostly people of youth, but we've seen in other states like Florida that the next step is to vulnerable populations and to older people. And then we're going to have a larger burden on our healthcare facility again. So for the youth, I say we're not invincible. We really have to take the steps necessary to stop the transmission of this virus. And that does mean wear a face covering, keep your physical distance, wash your hands. Many workers don't have a choice of working at home, and we've seen the number of cases and people who are essential workers also be higher. We want to make sure that we do what we can to support those workers and keep them safe, and our small businesses have what they need to keep safe. So again, go to the website. We do have access to everything from face coverings for community-based organizations to our providers for those experiencing homelessness. We also have other access for whether it's grocery vouchers or other food security, whether it's rent relief. There's a whole array of programs that you can be connected to that the City of Seattle can help you with that. And go to www.seattle.gov COVID-19 and you will see it all there. So thank you very much. I want to thank Chief Scoggins for his partnership, to Patty Hayes again, but also to the University of Washington and our healthcare providers. But mostly, I want to thank the residents and businesses of Seattle. You're the ones that flatten the curve. We need to take that kind of action again at that scale and know that we're here with you. So thank you so much, everybody, and have a safe weekend.